get right to tonight's main point. Should people have the same access to mental health care as they do to physical health care? Increasingly, experts, lawmakers, and certainly patients are all saying yes. But getting there requires changes, and that's why Kaiser Permanente mental health care providers are on strike across Northern California, and it's now stretching into its 9th week. And last night, Becca Habegger explained what's at the heart of the strike, but tonight she shows us why this problem, it goes back more than a decade.
So at the beginning of 2021, I think like a lot of people going through the pandemic, I realized that I needed to seek mental health care.
Maya Poland lives in Sacramento and describes seeking mental health care through Kaiser Permanente as convoluted and stressful. As part of the process, she says, Kaiser referred her to an outside provider.
Because the wait within Kaiser would be at least 8 weeks to do intake with a new therapist, and then another 8 weeks to schedule that first appointment, which just wasn't something that could work for me.
So she says Kaiser gave her a list of 10 external therapists.
I called through every single therapist and none of them were seeing new patients. Half of them had retired, despite Kaiser saying that these were people who were seeing new patients. From there, I got another list of 10 people. The last person on the list was able to see me, but not through the referral type I had. So I spent 6 months trying to get Kaiser to give me the correct referral type.
They eventually got it worked out and Kaiser reimbursed the provider, but Poland says it was a long and stressful process.
It is not our expectation that a consumer who's having a mental health crisis is going to call 50 providers, whether that's in or out of Kaiser, to find an appointment. That's the health plan's responsibility.
That's Mary Watanabe, director of the California Department of Managed Health Care, or DMHC, speaking at an August hearing of the State Senate Select Committee on Mental Health and Addiction. Watanabe's department oversees health plans, including Kaiser Permanente. This hearing was just days before mental health care providers at Kaiser were set to strike across Northern California, so committee members were asking about Kaiser's ability to provide timely access to mental health care.
We have enough information to indicate that there is a problem with access to care of behavioral health services at Kaiser. From 2020 to 21, we also saw a 20% increase in complaints to our help center from Kaiser enrollees.
She says her department has launched a special audit of Kaiser specific to timely access to mental health care. But this is an ongoing problem the DMHC has been following for years. In this routine audit of Kaiser conducted a decade ago, the DMHC found Kaiser was not ensuring timely mental health care appointments or tracking which contracted providers were available. It wasn't fixing issues quickly enough and not offering patients enough information on how to best access mental health care. The findings resulted in a $4 million fine, which Kaiser ultimately paid, but subsequent reports found many of the problems went not corrected, documenting ongoing issues with timely access to mental health care. So what is Kaiser Permanente doing? As part of bargaining with the providers, Kaiser says it's meeting the union halfway on demands for more indirect patient care time. Plus, we have shared with our therapists that we will have a framework to provide practice support that will dramatically free up therapists' time by having administrative and clinical professionals, including psychiatric techs, take care of administrative-related tasks and other work that does not require a licensed therapist. This means freeing up more of their indirect time. We estimate this could be as much as 30 to 45 minutes per day. Providers do want more of this time, but say what Kaiser is offering at the bargaining table is not enough. Meanwhile, Poland points out she gets great physical health care through Kaiser.
When I want to see a doctor, a dermatologist, my primary care, whatever that may be, I can see them within a week, which is really, really amazing. But to have to go through this entire really stressful process, really anxiety-inducing process, and then have to wait that long to be seen by a provider is just absolutely like shocking and horrifying.
And Becca's with us now. You've been covering this for a while, and there is a law now that requires Kaiser to provide timely mental health care services. Can you talk about that?
Yeah, we've been talking about it over the course of the coverage of this strike. It's called SB 221. It essentially requires health insurers, health plans, HMOs like Kaiser Permanente to offer follow-up appointments for mental health care within 10 business days. If a therapist, however, says a patient can wait longer, they can, but that's for patients who need it. And healthcare providers, mental health care providers who I've spoken with tell me that a lot of patients do need that immediate health care follow-up. And as you can see from this patient and from other patients we're hearing from and other healthcare providers, often there's a wait of 4 to 6, even 8 weeks before someone can get that follow-up appointment. So SB 221 requires places like Kaiser to provide that follow-up.
And some people at home might be wondering, how does the state make sure that Kaiser is actually following this?
That's a great question. So the California Department of Managed Health Care, they have several ways to ensure that. One of them is a help center hotline where they're collecting consumer complaints. Let's say a patient says, hey, I'm told it's going to take 4 weeks for me to get a follow-up mental health care appointment. They can call that number. The Department of Managed Healthcare says they are tracking these, and those indicate when a health system might have a problem. There's also audits that the Department of Managed Healthcare can conduct, like the one that you saw in this story. They also require these insurers to submit annual reports. So there's several ways that they're tracking it. And again, this is the first year SB 221 is in effect, so we will see how effective it is. Yeah, for sure.
All right, Becca, thank you. We appreciate it.